For more than 2 decades, Somalia has been in turmoil. Civil war has killed and injured millions of people and left the country with little infrastructure and virtually no health care. But one man is striving to make a difference. VOA's Ndiho has more.
With bullets ratcheting off nearby walls, World Health Organization trauma surgeon Dr. Omar Saleh is on the front line struggling to save lives.
I should be where I'm needed, and this is where I'm needed. I'm a trauma surgeon. This is a conflict. Trauma is every day. I must be there.
Hundreds of thousands have fled the violence in Somalia that has killed so many people.
You watch the news, you see, like, for example, 5 injured, 20 injured, 3 killed. Those people, their father, their mother, their child, their brother, their son. I get to know that.
When Dr. Saleh first arrived in Somalia in 2007, having already worked in some of the world's bloodiest conflict zones, he thought he would stay only for 6 months. But as one of the only 10 trauma surgeons in a country of 9 million people, he knows he's desperately needed.
My dad, he was a trauma surgeon. And even before, when I was a student, he told me, be anything, but not a trauma surgeon. But if I'm not going to stay here, or if I'm not going to do it, who will? Nobody. Any human being has the right to have an access to health care, irrespective, sex, gender, color, clan, whatever. You have bullets, shellings, burns, pressure injuries, blast injuries. Those are the main causes. Facilities are very basic, very, very much basic.
Dr. Saleh says that when he first arrived in Somalia, there were hardly any working hospitals, and many of the country's healthy workers lacked training in trauma management.
When we talk about hospital, people think that hospital is like hospital, something which is in the movies or whatever. It's not. It's like it was since like 50 years or so. You feel like your hands are tied, particularly when I know that the cure is simple and easy, but I don't have it. I care about people, and I have enough morals and thoughts and ideas and ideal to follow that and to do my best to help them. That's like an obligation as a human being with knowledge that I should pass to somebody else. My worst fear is to go to grave with my knowledge. I need to make sure that I passed it before I go.
Now, Dr. Saleh has trained nearly 100 Somali doctors in trauma surgery, and he has helped to set up more hospitals. But he believes that this is only part of the solution.
If I could stop something in the world, it would be war, because I find it a stupid thing. Big time stupid. People are dying because of what? Land? Who's more precious, the land or the people? The people.
I'm Ndiho, VOA News.